Scenario 4, chronic cough. The scenario has no history. So if you take history from this patient, you will probably get a big 0 for history. Okay, so there is no history in this scenario. The scenario is examine the chest physical examination, which is you have to examine the respiratory system. So obviously you have to go in a systematic step-by-step manner. Always, the key is wash your hand. Then you need to explain why you are doing this to the patient. So this is very, very important. So you can't just go and say, hey, look, I need to examine your chest, take off your shirt. That's not the right thing to do. It's not a culturally appropriate way. So you need to go and tell, hey, I'm Dr. Talari. As part of my examination, I understand you have a chronic cough. I would like to examine you. Is that okay with you? Consent. Always consent. And before you do that, wash your hand. First, wash your hand. Explain who you are and what you are going to do, and ask the patient consent. Without that, if you do it, you will probably fail. Then the next important thing is you need to expose the patient to the appropriate part of the examination. Then you need to go in a systematic way. So you need to ask the examiner, is the patient ill or well? Then vitals, then head to toe, then chest physical examination. That's when you come into the inspection, palpation, auscultation, and percussion. So you need to do this. After that, in this scenario, they give you spirometry. So you need to know what causes of chronic cough will be there in the spirometry. So you need to be able to read the spirometry. So you need to know the basics of spirometry, like what we read in AMC MCQ or your theory exam. It's very, very important. You need to know how to read the spirometry, because the next thing is you have to explain the result to the patient. I don't know the exact diagnosis because I didn't see the spirometry, but ultimately if someone has a chronic cough, then usually it could be interstitial lung disease or sarcoidosis, or is a smoker or COPD. So you need to rule out, you need to know the findings of all these in the spirometry. You need to interpret what the spirometry says. One second. So you need to interpret spirometry, then explain to the patient on how the spirometry result is giving us the diagnosis. For example, Mr. Smith, after examining you and reading your spirometry, or reading the test results, I think you have chronic obstructive pulmonary disease, or you have interstitial lung disease because of the FEV1 reading here, or the FVC, which is forced vital capacity reading here. When this ratio and this ratio are there, this is most likely a restrictive problem, which means you probably have this one. So that's how you explain the results, which means you will need to know how to read the spirometry. It's very, very important. You need to read spirometry, basic audiometry. You need to read basic ECGs. These are all common things. Like every medical student can read spirometry. Every medical student can read ECG. So you need to know those things as well. So without knowing those things, if you go to exam, then you're just making a fool of yourself, because you will fail. And that is minimum expectation to work in the Australian healthcare system, is you should know how to read a spirometry and interpret the spirometry. So if you would like to know more, if you would like to learn about all these things, next week I'm launching my group coaching program. You can join it for a ridiculously cheap price. The goal of the program is to help as many people as possible, and in the future, work with you guys in my clinic and other places. I work. I don't want to say too many things here because that's like giving false hopes. But ultimately, I want more doctors to be successful in the clinical exams, because in the next 3 to 5 years, lots of nurse practitioners and pharmacy practitioners will be coming. So it is the best time to get into the Australian healthcare system and start working as a doctor and be a good clinician, and maybe we will work together. So if you'd like to get faster results, be successful like my student who took this exam and smashed all the cases, and then I think the best thing to do is reach out, and I will send you the link next week, not this week, and you can join my group coaching program. I wish you all the best, and I will see you in the next video.